We're here for a healthier you.
Hello, I'm Dr. Jason Guevara. Welcome to the Pinehurst Hip Knee Center. We're right located next to the traffic circle and right around the corner from the hospital. And I'd like to show you kind of what an experience is if you come in and see me or one of my PAs, and I'll show you a little bit of the office. Well, welcome to the Pinehurst Hip Knee Center. Now that we're inside, let me just kind of run you through what a typical experience is for a new patient visit or even an established patient. First thing you do is you come over here to the check-in desk. You meet either Sarah, Mary, or James, and they will lead you through all the important HIPAA forms, all the insurance papers, answer all those questions for you, and get you ready for your appointment. They will actually call you before the appointment just to remind you, because I know everyone's busy and sometimes we even forget, on the schedule what time our appointment is. But after you've checked in, come and have a seat here in their lobby. Now I want you to note something. When you come here and hopefully you find a nice comfortable seat, one of the main things is we do not have a clock on the wall. The reason is that we value your time. We want to make sure that you're right on time for your appointment. We try to do the best that we possibly can. If we need x-rays ahead of time, we'll actually, our front desk will tell you on the appointment reminder to come in a little bit earlier so that we can get everything all taken care of. Your time is very valuable, and I respect that, and I try to treat you as if I was a patient as well. But after you've been sitting here reading all the greatest magazines, we got Us, People, all the rag mags, we got a lot of the Sports Illustrated, you name it, we've got some business magazines. Unfortunately, you probably won't have too much time to get into it. We do have some in the rooms as well, but we try not to keep you reading too long. But come over here. Your name will be called, and when you come in, first thing that you notice is probably Kelly. She'll probably call your name. She's busy right now, but we'll go ahead and do a height and weight on our digital scales, and then after we've done some of the vital signs, come over this way. A lot of times you'll get an x-ray first. You'll meet either Amber or Christy, and they'll take you in the x-ray room, and we'll get an x-ray of whatever is hurting you, and then we'll kind of go into one of the exam rooms. So let's go over here. Now, this is one of our exam rooms. When you come in here, one of the things is we've got a couple of chairs here for family members as well as yourself. We've got our exam tables, and if you look up here, we actually have an example. We've got x-rays up because it's nice for you to actually see exactly what's going on. For example, this patient here has got some space between the bones, and there's no space over here. We call this Bob, bone on bone. They've already had one total knee replacement, and they're preparing to have the other one done. We take care of a lot of specialized care. We do hip and knee replacements is what I specialize in. I also do a lot of sports medicine. But because I am an orthopedic surgeon, we've done carpal tunnels, trigger fingers, rotator cuffs, some back pain, bursitis pain, ankle fractures, you name it. We can pretty much take care of it. But after we've completed here, a lot of times we come right over here. And if you do need surgery, I think it is very important that you understand your surgery. So what we have is we've got Mary Ann, her surgery case manager, and she will go over step by step everything that you need to do in order to make your journey to that promised land of, say, a joint replacement nice, smooth, easy, and comfortable. BJ is our practice administrator. She makes sure that everyone's on time, and that we go ahead and do our best at all time periods. One of the things I'm very excited about is that I've been here for 12 years. And before I was in surgery a couple days a week, so our office we couldn't see anybody. But right now we've got two very experienced orthopedic physician assistants, and let me introduce you. They're probably working right now, but let's see. Yep, here they are. We found them. Well, this is Chad, and this is Sherry, and what they're doing right now is looking at the X-rays before surgery. We go ahead and template out precisely which implants needed for surgery, and that way we have the proper implant for the proper patient, And we don't like any surprises in surgery. I know you wouldn't want it. I don't like it. So we have everything planned in advance. But we're here open 5 days a week. You can come in and see myself or one of our PAs, and we'll take good care of you. Now, after you finish up your appointment, we'll go ahead and check out. We've got a specialized door right here just for a checkout shortcut. Here we check out and we get to see Mary, or Sarah, or James, but mostly Mary. She'll lead you through the checkout process and schedule your appointment for the next visit, and then we hope to look forward to seeing you again. Thank you.